Hi everyone, my name is Dr. Linda Erkely and I'm a geriatric psychologist and neuropsychologist at UCLA. And today I'm going to talk about practical tips for traveling with a loved one with Alzheimer's disease and other memory disorders. So welcome aboard. You can ask questions on Twitter using hashtag UCLAMDChat. So today I'm going to cover a number of topics that will help you decide, first of all, if you should travel with a loved one who has severe memory problems and what you can do to prepare for that, what you can expect, and actually what to do while you're traveling, what happens when you get to the destination, and what if you don't want to travel with your loved one. So the idea here is to target topics that are going to maximize safety and your enjoyment. So let's talk about why traveling to begin with. Well, traveling can be enjoyable for everyone. And it really can be a special time together, especially if your loved one does have a memory disorder. And you want to have some good times with them and make new memories with them before they have more degeneration in their condition. But besides pleasure, some patients or loved ones with memory disorders have to travel. For example, if there's an emergency or you're moving. So we're going to cover then topics about how to travel safely and enjoyably. Now, the first and most important question to ask yourself is, should my loved one travel? The answer is maybe, maybe not. Certainly people in the early stages of dementia or other memory disorders may still enjoy traveling and be able to travel. However, as dementia progresses, then people may no longer be able to travel. So try to be realistic about whether your loved one is capable of traveling, whether it's safe for them to travel, and be realistic about whether you can travel as a caregiver, given your level of health and your patience. Remember, you're going to be taking care of yourself, but you're also going to be taking care of another person. But there are definitely two rules of thumb when you're traveling with a loved one who has memory problems. Number one, never allow someone with dementia to travel alone. So you wouldn't want to put somebody on a plane and say, okay, you know, you'll be okay on the plane and so will pick you up when you get there. The other is never leave someone with dementia alone at a destination. So once you get to a place and you want to go out by yourself, please don't leave that person there without you, no matter if you're in a grand hotel or you're at a condo or someone's house. So let's talk about the first situation is, when should one not travel with someone who has Alzheimer's disease or dementia? So first of all, think about what dementia is. Dementia usually means that somebody has severe cognitive problems. Often it's memory problems, but it can be problems with visual spatial functions. It can be problems with mood, depression, anxiety. All these things come as a package with memory problems and severe memory problems, as you find in Alzheimer's disease or other forms of dementia. Sometimes people with dementia become aggressive. They might yell or scream. They might have delusions and what we call psychosis or breaks with reality. And they may pace. They might have agitation. And all these kinds of difficulties make it even more difficult for a person to travel. And definitely these can get worse when someone is away from home in a strange place, out of their comfort zone. So if you find that your loved one is doing things like wandering at home, might be aggressive, might have sundowning and a lot of confusion. So not just once in a while, but this is a regular part of what they are dealing with. Might be a fall risk and have dizzy spells, or even have unstable medical conditions. These would make it less likely that traveling is a good idea. Not only that, but if you have a loved one who, even though they're in their own home, says, I want to go home a lot, or they don't know where they are, that definitely would be a red flag against traveling. Incontinence, I gave it a couple of stars, and incontinence is not necessarily a reason to avoid traveling. A lot of people are incontinent, whether or not they have cognitive problems, but it can be a real burden if people have accidents. Remember that people can't change themselves. You would be helping with that. So if someone has a lot of problems with incontinence, it may not be a good idea to travel with them. So keep those in mind in making your decision whether it's a good idea to travel or not. And the rule of thumb is usually when you're traveling with a loved one, these kind of problems can get worse when you're away from home compared to when your loved one is at home in a familiar and secure place. So these are the risks of traveling with someone no matter what. And if you think about it, these can be risks for anyone, but the issue is they're more likely to happen when somebody has severe memory problems, or if they happen, it's much more difficult to deal with and help someone. So think about getting lost or separated. This is the #1 problem, and that's why it's on the top of the list. People have serious medical problems, and it's one thing to have them at home and you are capable of problem solving in that situation if you're conscious. But however, if you're not conscious, think about what could happen if you're away from home or somebody who doesn't know how to handle emergencies. Panic attacks can happen because people are feeling insecure and scared. Death can happen. It can happen on a trip. It's just one of those things that we don't have control over. But in this case, if somebody has a severe memory problem, death can be related to getting lost or separated. So someone can end up getting lost and being exposed to the elements, or being vulnerable to another person assaulting them or taking advantage of them. Your health as the caregiver is important. You certainly don't want to be contending with your own chronic or serious illnesses and having to take care of another person. And finally, caregiver stress. Are you under stress? If you're under stress at home, then chances are you could be under more stress when you have the added job of taking care of somebody while you're traveling. So let's talk about you. Remember, this is also a vacation for you. So how is your health? Do you have any medical conditions that would limit your ability to travel or to take care of someone else while you're traveling? Will you be able to handle emergencies if something comes up? So it's a good idea to get a checkup before you leave to make sure you're able to take care of your loved one and a situation that might arise. And the other is caregiver burnout. Caregiver burnout occurs when caregivers get pretty stressed out and tired because taking care of somebody is usually a 24/7 type of job. So if you have symptoms like insomnia, fatigue, anger or frustration, if you feel impatient or short-tempered in relating to your loved one, or if you have resentment about the job as a caregiver, you might need to take your break by yourself, because going away from home could mean, and probably will mean, more work for you. So caregiver burnout is a sign that you need to get away by yourself. Let's talk about help. Do you have help at home with your loved one, or even help, with transporting or having someone help you drive your loved one, helping you with the house, or helping you with caregiving, giving medications, bathing? So if you have that kind of help at home, you're probably going to need it on a trip. You might need it even more, in fact. So you might need help on the trip even if you don't have help at home. So remember, this vacation is for you and your loved one, and so you'll probably need some me time while you're away on the trip. So consider traveling with additional family members. Somebody who can help you in shifts so you have your own time to enjoy yourself. For road trips, definitely it is advisable to have a second driver. Now, what about planning and preparing? So once you decide that, yes, I think it's okay for me to go on a trip with my loved one, the next step is careful planning, because this is going to essentially make or break a lot of your trip. So plan your destination carefully. You could consider working with a travel agent who specializes in planning trips for disabled individuals or older adults. One thing to keep in mind is a familiar place is the best place to go. So going to a place where neither one of you has been to before, it's probably not a good idea. Plan your trip so that you travel during the times of the year that are off-peak times. Travel during times of the day where your loved one does best. So most people do better in the morning than at night or the late afternoon. So taking a red-eye with your loved one is not a good idea. Check with airlines for special escort rates. So they sometimes have rates for someone who needs to escort a loved one on a trip. And again, make sure that you pick how long you're going to be gone carefully. Shorter is better, especially if this is a first-time trip. And finally, the last point is, if you're going to fly, it's better to take a nonstop flight. But whatever you do, don't have a trip planned with short connections, because first of all, we all know how those can be missed, and then what do? It can be too much of a fast, tight pace for your loved one, because people with memory disorders usually need more time to get from point A to point B, so they shouldn't be rushed. So if you have to have a layover, consider longer layovers. Make sure you buy travel insurance, because things happen. And try to book a room for people with disabilities. It's just more user-friendly for everyone involved. Now, if you're going to someone's home, that's great. Think ahead, are there any young children or pets? Because that might not be an ideal situation for the children or the pets or your loved one. And it's great because when you're going to someone's house, you can bring your own food, you can use the refrigerator, so there are many pluses involved in that. And even things about what you're going to do during the day, make sure you plan your activities. Don't leave things to chance. Be sensible. You can plan your schedule. Even eating out. Think about making reservations instead of just going somewhere and having long waits. And try to eat out at off-peak hours, because there are fewer crowds and less confusion for your loved one. So in general, prepare for the unexpected when you're traveling. We would do this anyway, but when you're traveling with someone with a memory disorder, it becomes extra important. So I'm not trying to be negative, just trying to be sensible and proactive and helping you to really enjoy your time as much as possible with your loved one. So prepare for the worst. Prepare for becoming separated. Think about time zone changes and how this could affect the sleep and wake cycle of your loved ones. We all know what it feels like to have jet lag, so this can be worse for your loved one. They may not even understand that it's jet lag anymore and may have a reaction just to that feeling of malaise and fatigue that we know happens when we get jet lagged. People are likely to wander more if they're traveling, and so if this is already a problem, again, we said it may not be a good idea to travel, but it could happen even for the first time while you're away. You can expect more problems with orientation and memory. Remember, your loved one is not going to have a frame of reference for where they are. Now, if somebody's in the mild stages of dementia and they've been to a place many times, they may still recognize where they are. But even so, because memories is affected profoundly in most disorders of dementia, like Alzheimer's or Lewy body dementia, you may be surprised and find out that your favorite getaway is no longer familiar to your loved one. Think too that your loved one could have some mood changes and anxiety or agitation in a new place, and they might feel insecure. So let's talk about the worst scenario or worst case scenario of becoming separated. So here, being proactive is most important. Definitely recommend some kind of system for identification should you become separated. So a good one is the Medical Alert and Safe Return system. This is through the Alzheimer's Association. It's reasonable and it works. So now this is a nationwide network, an emergency phone number that you can initiate a search if you get separated. And you get a kit. Your loved one gets ID bracelets, and you have a choice of different ID bracelets here, and also a wallet card. In addition, for a few extra dollars, you will also get the caregiver can get like a bracelet or some ID if something happens. So that's really important, because if you're wearing the bracelet and something happens to you, then people will know that somebody is dependent upon you and take action. Now, one thing to remember is if your loved one already has this, then you need to notify the Safe Return before you leave on the trip, and always wear your bracelets. Besides the Safe Return system, there are GPS tracking devices that are available. Now, there are a number of them on the market. I've listed a few here as examples, and these are great. You can track where your loved one is on a computer, on a cell phone app, or even get emails. If your loved one leaves kind of like a safe zone or radius, then you'll get a notification. Some of these GPS systems can be used internationally. Some are limited to the domestic travel. And some of them also include a search team response. So not just notification, but you can get people to help find your loved one if the alert is activated. So there's a few. There's iTrack, GPS tracking system, which is international. There's also Project Lifesaver, which has an emergency team response. Blue Water Security is a wristwatch. And also, it's a good idea to contact your cell phone company, because they may have some programs for GPS tracking. So these modules are usually small. They can be worn on the body, like for example as a watch or a bracelet. And there's one that even goes in the sole of the shoe. So now I'm going to talk about a few specific forms of travel that are pretty common that you might be considering for your next trip. So let's talk about air travel. Think about what it's like for you to air travel. So there are crowds, long lines, security being very intrusive. Now think about the perspective of someone with a memory problem encountering those same situations. So it can be very scary and extremely tiring for someone with a severe memory disorder to travel. When you're going through security, people are going to be asking questions. They're going to be asking you to take off parts of your attire, your shoes, and of course, you might get patted down. You will have to go probably into an X-ray screener. This can be frightening for someone who doesn't understand what's going on. And during those times, they're going to be separated from you, even if it's for a short time. So, it's really helpful in these situations to notify staff of your needs, to check in ahead of time, allow plenty of time to go through these processes, print your boarding passes ahead of time, use sky caps to help you get around, and again, avoid tight connections and peak travel times, and try to bring comfort items with you. Now I'm going to talk about that in a minute. Traveling light is important because you're going to need an extra hand to take care of and help your loved one. So don't load yourself up with a lot of carry-on baggage. Stay close to your loved one. Remember, the airport is a very busy place. Try to wait in quiet places. And be prepared. You shouldn't have to be taking off jewelry and belts, etc., in the line when 10 people are behind you being impatient. So don't wear jewelry. Put liquids, etc., in the plastic bags ahead of time. Be prepared, because this is going to help de-stress the situation. You will be in charge of your loved one's ID and passport. So hold on to those. And take advantage of the family security lanes, family restrooms, and pre-boarding. So remember, these are for individuals not just with children, but for people who need extra time to get settled. Now, it may be very beneficial to have a letter from your doctor when you're traveling. So this is an example of a letter that essentially, if you can't read it, it says, Mr. Smith is under my professional care in the neurology department at UCLA or whatever hospital. He's been diagnosed with Alzheimer's disease. Due to this dementia, he has had considerable difficulty expressing himself and may not be able to understand and follow directions. He might become confused in unfamiliar situations. He functions well with the assistance of his caregiver, Susie Smith, and it's important that they not be separated as he depends upon her for direction and guidance. Any special consideration that can be extended, such as pre-boarding or understanding during the screening process, will be helpful. So this might be something really handy to have with you and to get from your doctor or your loved one's doctor ahead of time. So let's move on to another popular type of travel and vacation is a cruise. Cruises can be great. They're self-contained, nice meals, activities on the ship. If your loved one is feeling tired or you're tired, you don't have to disembark the ship. You can stay on the ship and enjoy yourself. So cruise could be a good idea, but remember that things happen on cruises that can be unexpected as well. For example, weather. So you might encounter rough seas. Also, be aware of where you're going because ports vary regarding accessibility. What's it like to get off the ship? Is the gangplank steep, for example? Do you have to use a transport boat to get to port? Because the ship actually doesn't dock, it stays anchored. So these are all things that you should know about before booking your ship. And actually, wherever you go, it's really important to think about how your destination, where you're traveling to, the amenities and the accessibility for individuals. So in the United States, we know that there's a lot of accessibility for people with disabilities, but that may not be so in other countries. So keep that in mind when you're booking your cruise or booking any reservation to go outside of the US. Also, notify the staff in advance of your needs. And in fact, you can have trip personalizers. I saw this when doing some research. For example, Princess Cruises has this. So I'm not advocating a specific cruise line, but check at the cruise line where you're going, because this would be a great service where you can try to notify individuals in advance of special needs. Also, think about where you want to get a stateroom. So get a map of the ship. Find out where most of the activities that you're going to be doing with your loved one are occurring, and try to get staterooms near those locations. Another thing that is recommended in the last point is collapsible wheelchairs. So this is great because you might have to contend with narrow spaces and narrow doorways, and they're also easier for packing and taking places. So that's another idea. So cruises can be a good idea, but think about also the size of the ship. So some ships are floating cities. Do you want your loved one to be around a lot of people, or do you want something smaller and more intimate? So that's another consideration. And think about the length of your ship, the length of your cruise. So it might be a good idea to start out with a 3 or 4 day cruise instead of booking a 2-week cruise, for example. Now another trip is a road trip. Road trips can be great because you have a lot of control over where you go, how you travel, the pace that you travel, where you stop, etc. So road trips are a good idea. But make sure you plan your route, and this includes amenities, rest areas, and also a lodging along the way, because you might need to stop. Perhaps your loved one is tired and you need to get off the road and spend the night, and you didn't anticipate doing that. So make sure that you are not traveling in isolated areas, for example, where there aren't many places to eat or stay. Stop more often for stretching, for restroom use, and for food. And bring comfort items and busy work with you. So pillows, snacks, music. If you have an iPad, that might be a good time to load up some old movies that your loved one enjoys watching. Definitely allow more time. So if you're driving to, let's say, San Francisco, most of us can do that in 5 or 6 hours. You're going to need to tack on a couple of hours with your loved one. Don't expect to go at the same pace. Also, it's great to have a co-driver. Then you can switch with another driver if possible, and it's usually recommended about every 6 hours. Now, one of the biggest fears, and it does happen, is that your loved one grabs the steering wheel. And maybe that person has never done it before, but there's always a first time, and the first time could be a very lethal situation. So this is why it's often recommended that your loved one sits in the back seat while you're traveling, far away from the steering wheel. And that's why it's a good idea to have a co-pilot with you. Because if you have a co-pilot, then you can sit in the back with your loved one and switch driving. And that way you can be close together and you can do activities together, but you're there to make sure that nothing happens unexpectedly, such as grabbing a steering wheel. If you have someone who already has a tendency to do that or wants to jump out of the car while you're driving or even while you're parking, is impulsive, then taking a road trip is not a good idea. So let's talk about a few more safety tips for when you travel. First of all, keep a bag of essentials on your carry-on luggage and with you at all times. So this is very important because you never know when you might need them. So this would be extra medications. Also, the medications, the list of what your medications are and the dosages. Emergency contact information, and a list of your medical condition and your loved one's medical conditions. Keep copies of passports or other legal documents with you. This could be advance directives, insurance information, and policy numbers. Always keep a picture of your loved one with you. So if you get separated, at least you have a picture to help find that person. Bring a comfortable change of clothes and have snacks, and definitely have water, because one of the risks of traveling for anybody is dehydration. And definitely you're going to have to remind your loved one to snack and drink. Keep emergency contact information with you, but also give your travel itinerary and emergency contacts to your information of where you are to your emergency contacts. So make sure that your loved ones at home have the information of where you'll be and where you are staying and what your plans are. And then put the name of the hotel and contact information on your loved one's person as well. So if you do get separated, they'll be able to people will be able to find you and contact you. And definitely remember, you're going to be wearing your ID bracelets as well. The other important thing is, let me go back, when you're traveling, it's really good to have extra medications with you so that if something happens and you lose your luggage or your purse gets stolen or something like that happens, you'll have an extra stash somewhere, at least enough until you can contact a loved one. And then it's also important to know where you're staying. So know if there is hospital nearby, and know what the amenities are where you are going, so that if an emergency does happen, you'll be prepared. So we talked a little bit about busy work and keeping your loved one entertained while you're traveling. So think about things that you can bring on a plane, or things that one can do in the car. So it could be scrapbooks, it could be puzzles and games, interesting magazines. Again, watching old movies. A lot of airlines have old movie stations, but if not, and you do have something like a tablet or an iPad, you can download some old movies for the trip. Make sure that you stand up and stretch, because we know that traveling can be associated with deep vein thrombosis from not moving around. So you're going to have to remind your loved one who has a memory problem to move and wiggle and stand up and walk up and down the aisle. If you're in a car, take stretch breaks. What about when you get to your destination? So now we've talked about how to decide if you should be traveling, what to do to prepare ahead of time, how to handle the journey, and now you're at your destination. So what can you do to maximize your enjoyment and safety and have a pleasant trip once you get to where you're going? So first of all, check the room for safety risks. Are there coffee pots that are plugged in, etc.? Bring a nightlight with you, because you're going to need light. And for example, you might want to leave a bathroom light on if you don't have a nightlight. Space out your activities, so get rest. Have days where you do things, but have times where you come back to your room and you relax or you take a nap. You might have on and off days, so days where you stay around if you're on a ship and rest, or stay in your hotel room, or do something in the morning, come home and rest in the afternoon. So space it out. If you're used to go, go, go all the time, that's not something that you will be able to do as a caregiver with a loved one. Think about your loved one's good times, alert times, and tired times. Think about what times of the day they're good at doing things and other times when they're not so good. And try to capitalize on that and work around that, work with it. So if your loved one is slow to get going in the morning, you might want to think about eating breakfast in, for example, instead of going out. And try to prevent wandering as much as possible. So don't wait for your GPS to go off. Do things to prevent your loved one from leaving. So you can actually bring a door alarm with you on your trip, and it may be just as simple to cover the doorknob, because just seeing the doorknob can trigger somebody to turn it and open it. So think about that and being proactive in preventing wandering. Try to maintain your usual routine as much as possible. So this is not going to be literally doing the same activities that you do at home, but try to keep the schedule about the same. So keep going to bed and waking up in the morning around the same time. If your loved one likes to exercise, do some exercises. You can do chair exercises in the room. You can do walking. Try to keep the diet close to what your loved one is used to eating or likes to eat, and work in nap times. Now, before you plan a big trip, do a trial run. Take a short trip first and see how it goes. Stick to a familiar place and stay close to home. If that works out, then you might plan something a little more elaborate. If that doesn't work out, then that should be information to you about maybe not taking a longer trip. Also, think about booking in advance, how far one books in advance. So a lot of the times we plan a trip a year in advance, 9 months in advance. If someone has a progressive memory disorder and they get worse over time, they may actually progress to a point where they're not able to travel in a year. So that's something to think about, that your loved one, if they have a progressive neurodegenerative disease like Alzheimer's disease or frontotemporal dementia or Lewy body dementia, they may not be able to go in a year. Also, have something with you that you can hand out to other people so that if you do go and your loved one starts to get upset or might be asking somebody strange questions or is just, trying to do the best they can, but it's obvious that they do have a cognitive disorder, you can give someone a note that says, my loved one has dementia, Alzheimer's disease, and may sometimes do things that are not quite expected. Please have patience and thank you. So you can have a note like that you can give to people. Some people do this and recommend it highly. Other people aren't comfortable with it, but that's up to you, but it is an option. So after all of this, what about if you want to go by yourself? Is there anything that would prohibit you from doing that? Well, let's talk about your feelings first. Now you might say, oh, I can't go. I'd feel awful. I'd be abandoning my loved one. My loved one needs me. I can't go. Well, that's not necessarily true. You're not abandoning your loved one. And in fact, taking a trip might be better for your relationship, especially if you need a break. It's important for your health. Remember, if you're not healthy, your loved one is not going to get good care. So it's a way of taking care of yourself, but getting away is a way to take care of the both of you. So in those situations, you can consider what is called respite care. And this is having your loved one take a vacation somewhere while you're on a vacation. But their vacation is going to be usually at a care facility, like an assisted living, or if they need more help than that, a skilled nursing home, for example. Now, if somebody really needs a skilled nursing home, they're not going to be a good candidate to go on a trip because that means that they're so dependent that they can't do very much by themselves. So probably if you have someone that maybe might be able to travel, but you're not ready to travel with them, or they have some issues where they're not a good candidate for traveling, consider going to an assisted living type of facility. So that way the person will be under supervision, they'll be safe, there will be activities for them, and the people are experts in caring for them there. Now another option would be have somebody come and stay with them in the home. And that's going to take some vetting of individuals. That would be somebody who has training that they need to be at your house 24/7 caring for your loved one. They're going to be strangers though. So maybe somebody familiar could stay with them. They could stay with a relative as long as their house is set up or they are knowledgeable enough to care for your loved one while you're gone. And certainly you can discuss this with your loved one, and if they're going to an assisted living residence while you're on your trip, you can discuss this with them as they too are taking a vacation. So that wraps it up for the talk, and I think you have a good amount of information to really make your decisions about whether you should be traveling with a loved one. There are great resources out there. One of the best ones is the Alzheimer's Association. So check out their website, either the website of the National or the Greater Los Angeles Alzheimer's Association. You can also find out, call the airlines, call cruise ships, and definitely find out what kinds of services and amenities they have that will make it easier, more pleasant, and safer for you to travel with your loved one who has Alzheimer's disease or another kind of memory problem. And so now we're going to open the floor up to any questions that you may be tweeting in, and I'm happy to answer them. Okay, so here's one question from an audience. Is an MD letter necessary or free? That's a good question. It's not necessary to have a letter from your doctor. I think this is something that is a good way to communicate with others that your loved one has a medical condition. Is it free? That one I can't answer. You'll have to ask your doctor about that. One way, though, maybe one thing to think about is when you go to the doctor, because your loved one should probably get a checkup before your loved one goes on a trip, you might be able to ask the doctor at that time. Do you need to hire a travel caregiver or a psychologist? You don't need to hire a psychologist for traveling, but you might need to hire a caregiver. It really depends on how much help your loved one needs at home and how much free time you want while you're away. And of course, caregivers aren't free, so can you afford it? If you think that you can't manage, or would feel probably overburdened by traveling alone with your loved one, then somebody else needs to be with you. Let your instincts be your guide in that situation. And you can either travel with a family member or travel with a caregiver. If you have to dress, someone needs help getting dressed, if they need help going up and down stairs, they're a fall risk, and you can't be there by their side all the time, then you're definitely going to need a co-host on your journey. Any other questions? Okay. All right, well, thank you very much for tuning in today, and happy trails and safe travels to all of you. Thank you.